Hey, friends, welcome back to the ASAP Pathway Podcast. I'm your host today, Dr. Stacy Becker, and I am really, really excited to have a friend and someone I just really look up to in the sleep world for many reasons, and you'll find out why. Dr. Shane Creado. Welcome, Shane. How are you?
Thank you, Stacey. I'm doing great. Such a pleasure to see you again and to speak to people who are really interested in improving their sleep and understanding how we can do that in meaningful, tangible, simple ways.
Agreed. Agreed. And I think golly, I was thinking the other day, how long have I known you, Shane? And I mean, I want to say it's been about 6 or 7 years when I first met you in Chicago. And
Yes,
it was just, just talking about collaboration and how can we get our, different fields to communicate better. And we've just stayed in touch ever since. And I've personally, and I'll read Dr. Criado's bio here in just a minute, but he is with the Amen Clinics and he has his own company as well. And I'll go over all of that. But I've even brought my own family to see you and have been just so honored and privileged to work with you professionally and personally. And I'm just thanks for spending some time with us today because I know you're a busy man. And you guys are going to see why he's very busy here. So if you don't mind, I would love to just share a little bit about you before we dive in. We have a lot to talk about in the small amount of time we have.
sure.
Dr. Shane Criado is a double board certified sleep medicine doctor and psychiatrist. He practices functional sleep medicine, integrative psychiatry, and sports psychiatry. He completed an undergraduate degree in physical therapy, graduating at the top of his class. He then went on to do an MD, graduating at the top of his class and being awarded the gold medal for obtaining honors in every subject in medical school. He was also collegiate champion in badminton and table tennis. I think I'm going to challenge you to a game now.
Let's do it. It's a great sport for the brain.
It makes sense. It would be. He completed his psychiatry residency training at the University of Wisconsin, where he was awarded the Graduating Resident Award for Academic Achievement. He then went on to a fellowship in sleep medicine at the University of Wisconsin because of the huge overlap between sleep and psychiatric issues. So true. As a sports psychiatrist and sleep performance doctor, he has been on the board of directors of the International Society for Sports Psychiatry, ISSP, for several years and works with a number of elite athletes, CEOs, and business leaders. He is and has been affiliated with the Amen Clinics, the PGA Tour Europe, the NBA Players Association, the Australian Football League, U.S. Olympic and Paralympic Committee, Miami Heat, Sunbelt Conference, Chicago Blackhawks, the Rafa Nadal Academy, and more. He is now the delegate for the USA for the International Summit on Advancing Sports Psychiatry, chair of the Sleep Performance Committee for the ISSP, as well as the chairman of Innovation and Technology for the ISSP, working toward the integration of sleep and performance metrics in the technology space. Oh my gosh. You
Thank
need
you for
to,
the kind
you are
introduction.
amazing. You
Uh,
just need to work a little harder in your professional life. I don't know what to say.
I know I'm very lazy.
You're amazing. Um, I think what's unique, and for those people that don't understand, who the Amen clinics are and what makes them different, I really challenge them to look it up. I mean, you guys definitely have taken psychiatry to a whole different level. You don't practice psychiatry the way that the average psychiatrist practice psychiatry. And how is that? What makes it different? How do you practice psychiatry, sports psychiatry, and sleep medicine differently?
Yeah, so it's different because we don't look at symptoms as the cause. So in psychiatry, if someone's diagnosed with something like major depressive disorder, Stacey, there are certain symptoms that they have to meet. And then they say, well, okay, you have five of these criteria, so congratulations, you could get a diagnosis of MDD, major depressive disorder. But psychiatry is the only field in medicine where we group symptoms together and slap a diagnosis on there. Well, what is the cause of the depression? What are the underlying factors affecting someone's mood or their dopamine or their stress hormone levels? Could be inflammation, could be sugar, could be food sensitivities, could be gut health imbalances, hormone imbalances. So the diagnosis in psychiatry doesn't tell us anything about the causative factor. And then pharma companies design a medication based on a diagnosis that's connected only to symptoms. And then we wonder why the efficacy rate of the average SSRI is 30 to 40%,
Mhm.
which is similar to placebo effect. That's also around 30 to 40%. So our approach involves neuroimaging or functional brain imaging, SPECT imaging, that looks at blood flow and activity in different parts of the brain. And then we know what these parts of the brain do from neurophysiology. So if the frontal lobes are not working properly, and we know that they help us with attention, focus, processing speeds, executive functioning, task organization, prioritizing things, motivation, drive, social connectedness. And if they're not working properly, you'll have symptoms that may mimic ADHD or depression. And it's very easy to diagnose somebody with ADHD or depression based on symptom clusters. But then what are the underlying factors that damage that brain region? So we bring neuroimaging to integrative psychiatry, same as my sleep practice. What are the underlying factors sabotaging someone's sleep? I don't care about how much sleep you're getting. I care about the quality of that sleep and the timing of that sleep as well. And if you have insomnia, is it difficulty falling asleep or staying asleep or waking up too early? Or are you getting enough sleep, but you're feeling miserable the next day and you're not functioning at your peak? So, what about your daytime functioning? What are we tracking here? Is it just how much sleep you're getting? Or your reaction times, your depression and anxiety scales, or with my athletes, their performance metrics, biomarkers, because sleep problems affect your testosterone levels, inflammation markers. So, we're looking at everything upstream, we're looking at the symptoms and how all these things contribute to those symptoms, but also all the downstream effects. And there are multiple points of intervention there based on not just blood work, toxin exposures, hormone imbalances, inflammation, gut health, that we can help shift the downstream effects by those interventions. So that's basically what we do in a nutshell.
It's so different. Um, I think the average person listening is probably understanding quite well what you're talking about, walking into your primary care, your doctor, what have you, psychiatrist, and saying, I feel XYZ, based on these symptoms, and then this medication is prescribed. And it's, I hate using the word experimental, but it is definitely, hey, let's try this. I mean, there's definitely obviously some, it's not a complete guess, but there's research behind, okay, you have these symptoms, these medications might help. But like you said, the success rate is so low, close to that of a placebo, a sugar pill, or, just taking something that isn't even the medication at all. I mean, that is a disaster as to how we're handling mental health. And what was really interesting when I came across you and the Amen clinics and what you guys are doing, you think about a profession. Myself, I'm a dentist. I'm also a sleep dentist. We do imaging. We image what I'm going to work on to come up with a strategy, a plan. Let's get to the underlying issues. And almost every specialty has some kind of imaging or testing. And it just seems like psychiatry is more about a checklist or symptomology versus scanning the organ in which we're trying to help. And that's what makes what you guys do differently. And what I loved, something you said too, when I brought two of my kiddos to you guys. With the first kiddo, she had a lot of mental health issues. This was my stepdaughter, and oh my gosh, label after label after label after label. And I'm standing back watching, and I'm like, so much of this, I'm watching how she eats. I'm watching, I know she had sleep apnea, we did some testing. I knew her vitamin D was low, all these different things. And she came to see you. And man, you had so much hope for her. And you said, let's remove all the labels and let's address what your brain is really basically starving for. You know, what is your brain hungry for? Where is it overactive? Where is it underactive? And let's start there. And you made some changes, removed some medications, changed some medications. And I just was blown away. I'm like, why isn't all of psychiatry like this? And the importance of sleep with psychiatry. I mean, this girl has been sleep deprived for so many years and she was on 7 different medications, Shane. So, and I know you see this every day, all day long. Um,
But you're right, it's so sad to see people suffering branded with additional diagnoses like treatment resistant depression, when it's usually the doctor that's resistant to looking at other underlying factors that are causing those issues, as I like to call them, the cascade of catastrophe, right?
oh,
So that's where we partner with experts like you. So if there's somebody who has sleep apnea or depressive symptoms, well, there's a huge overlap with sleep apnea and ADHD, huge overlaps with sleep apnea and depression. 20% of patients who have treatment-resistant depression may have undiagnosed or untreated sleep apnea. So we need to pull in the resources that exist in a comprehensive, meaningful way. Mold toxicity can manifest
mm,
with brain fog or anxiety or sleep disruptions. Inflammation is a common pathway for fragmented sleep and poor daytime functioning. Of course, you're going to feel depressed if you have no motivation to do anything meaningfully, or if your brain is in second gear when you need it to be in fifth gear. And then it's a snowball effect. But the good news is there are resources, right? There are things we can do. We just have to remember that guidelines or certain studies may not really factor in the nuance that is an individual. So treating a person as a human being rather than a lab value
mm.
is my approach.
So, what do you think is among your colleagues that are not practicing this way? What is the resistance? What is the holdup of this just not taking off like wildfire and us treating human beings this way all across psychiatry and sports medicine and um, sleep medicine? Like, why? What do you think the resistance is? Do you think it's just going to take time, or what do you think is the holdup?
Well, we've got to look at the AMA, American Medical Association, and who funded them way back in the 50s, then take over the curricula. I won't get into those details.
Right.
So where more and more doctors are trained to be pill pushers, and we know that all the natural or integrative holistic approaches were then deemed alternative, and only pharmaceutical based interventions were then deemed to be gold standard or standard of care. So not practicing standard of care could mean losing your medical license. On top of that, we're trained to be salesmen just for medications in the medical field. On top of that, we're not looking at studies that are not independently funded rather than looking at studies that are only funded by big pharma. And there are certain medications that are helpful in the right context. Don't get me wrong, I'm not
Right.
against medications, but who's funding the studies? Who funds 80% of the FDA's drug oversight budget, for example? Why aren't studies being done on the benefits of natural therapies? Well, who's going to profit off those things? And so we've got to look at the systems and really how it trickles down to medical providers who might have their patients' best interests at heart, but are just not provided the tools or the educational opportunities to know better. And then insurance companies are going to incentivize seeing a patient for 15-minute med checks as opposed to a more integrative holistic approach. So there's multiple reasons why it's reached this very sad state of affairs.
Mm.
And without getting political, we need to make decisions based on patients' best interest. We wonder why we pay more than any other country on healthcare. Well, it's a chronic disease epidemic. And what's causing that? What's driving that? Toxins in our food and water, um, a lot of seed oils that have been introduced into our diet, sugar and highly processed foods. Those are causing weight gain, unhealthy weight gain. They're causing inflammation,
Mm,
sleep apnea, and depression. So it's the environmental, it's the food industry, it's big pharma, it's the AMA, it's how we're trained and what resources we have. So if all you have is a hammer, everything's gonna look like a nail, as they say.
yeah, I just had this conversation, had Sarush Sagi on a podcast. He's an ENT out of California with the Breathe Institute. He just said pretty much what you were just saying. Like, medical school is really good at, training in pharma, and here's this symptom, and you're going to give this medication. We're not really training our up and coming health practitioners in healthcare. Really, it's more disease care, chronic disease care, how to just crutch people along. And it's just not really an environment that's going to graduate a bunch of, and in fairness to these doctors, right? Like you said, most physicians have your best interest at heart. It's just they don't have the tools necessarily. So, and this is where I feel, um, golly, patients are just having to take their autonomy. They're just going to have to be their own advocates. Shane, they have to listen, they have to study, they have to, like you said, it's so multifaceted, it can feel so overwhelming. But if they could just start with one piece somewhere, and as simple and basic as the pillar of sleep health, which then goes on to other aspects of wellness. If you're not sleeping well, your mental health isn't going to be well, your performance isn't going to be well. Um, your overall life, your quality of life isn't going to be well. So maybe start somewhere. And then when you can get to, okay, let's get sleep better. Okay, maybe we have to look at diet. Maybe we have to look at your environment because we are such an inflamed society. And what inflammation does, friend, oh my gosh, is
It's
awful.
devastating. Oh, you said it. So if for our listeners here, one small example would be if you have symptoms of ADHD, what's the guideline? Put them on a stimulant. Well, many factors contribute to concentration problems. Anxiety is a big one. So, what's causing you to be anxious? Why don't we use some natural supplements, or why don't we look at your stress hormone levels, or why don't we incorporate some breathing exercise like physiological sighing? What else can affect your concentration besides anxiety? Poor sleep quality, like sleep apnea or inadequate sleep. Most teenagers get 7 or less hours of sleep a night, but most teenagers need around 9 hours of sleep a night. And that's needed for frontal lobe function and development, which contribute to concentration. Lead can block iron, and iron is needed to make dopamine. So if you have lead in your water and that's built up, your dopamine is going to be blocked and you'll have concentration problems. You need iron. Iron is a cofactor that's needed to make dopamine.
Yes.
You need magnesium for calming the nervous system down. You need all these things to fit in. Seed oils and sugar and fast carbs can drop your concentration levels. So why don't we look at these underlying factors? Why don't we look at the studies that have shown comprehensively that 20 to 30 minutes of brisk walking 5 to 6 days a week are equivalent to maximum doses of Zoloft, long-term studies. Why
Good
don't we talk
grief.
about that? Or about the fact that sauna use has been shown in decade-long studies in Finland to reduce dementia prevalence by 66% and heart disease prevalence by 55%. Sauna use, yes.
Good
Why?
grief. Get a sauna, everybody. Go visit a sauna, get a sauna. How many days a week does the study show helping with prevention of dementia, or can they
They
say,
did. They did. So for the 33% prevalence reduction in dementia, they were using a sauna like 3 or 4 days a week. And for 66% reduction, it was 5 to 6 or 7 days a week.
my gosh. there's one take home from today, it's get in a sauna. I've been listening, there's so much coming out about, extreme temperatures, whether it's ice baths or, getting yourself in these higher temperatures. And what was it about the sauna that was helping with dementia? Because what my understanding with dementia is, that primary respiration in the brain, the pump, we're just not seeing it, flushing out the brain like it should. And then we're getting all these, gooey bodies, if you will. And we're just, our faculties aren't all there because our brain isn't cleansing itself. Is there a relationship with sauna use? And what is the relationship with those temperatures and dementia?
Yeah, so dementia is cognitive decline that meets criteria for functional impairment. And dementia is a broader term. There's over 40 different contributing factors to cognitive decline, even the B vitamins, gut health, sleep apnea. But in terms of the sauna use, there are several theories as to why saunas are so effective in dementia prevalence reduction. And some of those factors include sweating out toxins that build up in your system. Number two, stress hormone cortisol level reductions, because chronic stress hormone level elevations lead to shrinking of the gray matter in your brain.
Mm,
Then we're talking about reduction in inflammation, which is a common pathway for slowing your system down and damaging the vascular system and blood flow to the brain over time. Then we think about endorphins, dopamine, calming effects of sauna use. We think about pain because the thermoreceptors in the brain and the body help suppress pain. So if you have some chronic arthritis by means of inflammation or pain, that's reduced. Your nervous system is not on guard all the time. So chronic sympathetic nervous system overload or
mm.
stress mechanisms kicking in can drive downstream brain issues. And then also, if your brain is heating up and it has to flush out toxins, it's going to have to open those lymphatic channels that help flush those toxins like beta amyloid out. And beta amyloid is a reactionary protein, right? It's a reaction to something going on within the central nervous system. So we got to think about things like nanoplastics. We got to think about
Mm.
chronic viral illnesses like CMV, EBV, HSV. We've got to think about undetected bacteria or parasitic issues that may be kept under wraps. So you're not experiencing symptoms, but your brain is and your immune system is like, wait a minute, this is not normal. This is a foreign body to us. Let's attack this. And beta amyloid accumulates. And if you don't manage to flush it out effectively, it builds up in greater amounts and can lead to damage to the brain over time. But the flip side is saunas are very good strategies to help remove some of the gunk that kind of builds up over time.
That
Uh,
makes that
sauna
makes
use
sense.
reduces it.
Yeah.
Same with sleep, right? There was this independent study showing that basic rubbish sleep strategies you can look at online can reduce the prevalence of dementia by 15%. What does that mean for us? Well, if this country contributes $355 billion a year to dementia care, and 15% reductions with some very imperfect, non-scientific sleep strategies you can print from Google, reduced by 15%. That's a savings of $55 billion a year just with some basic sleep strategies,
Mm.
just in the dementia realm. Well, we know that optimizing your sleep can reduce your high blood pressure issues. Maybe you can get off one medication. What if a million people get off one medication for hypertension? That's a savings of $100 million a month. What about Crohn's disease and relapses? Direct correlations with poor sleep, cancer, heart disease, strokes, immune system. So I think these are areas that are easy to intervene at, right? And sleep is a modifiable risk factor for the
Mm.
10 most common cause of death and disability in the world. So why not start there? Why not
Yeah.
get the basics right? Why not do
It's
the free stuff first?
it's so interesting too, especially when I talk to men about sleep. And I don't know if you come across this. Um, there's a defensiveness sometimes. Like, if some of my patients, when I talk about sleep, they're like, I'm fine on 4 hours of sleep. I don't need, they see it as passive. They see it as weak. They see it as, I got to be going, going, going. And I'm trying to get the message out. No, if you want to be your best manly self, you need to get sleep. You need to get that sweet 7, 8 hours. Like, that's so important. Your body needs that rest and recovery to decrease that inflammation for your optimal, testosterone production is in your sleep. Um, all of these things, growth hormone is produced in our sleep. So if you're a kiddo and you're not getting proper sleep, you're not getting that growth hormone production like you should. And for an adult, growth hormone is repair. So you're in pain
Yes.
and you're not repairing. And so it's like you said, if we could all just take away, like, let's just start with one thing: sleep health. It's so important. Um, Something you said earlier, I mean, because it's kind of like the chicken or the egg. If you have inflammation, inflammation affects absorption of certain nutrients. But also, when we don't have enough of the nutrients we need, that can lead to inflammation as well. So, vitamin D levels affect ferritin with the hepcidin relationship. Like you said, ferritin and iron is a cofactor for dopamine. And then, if we don't have enough dopamine, we have movement issues. We have things like, restless leg syndrome or restless sleep disorders, which fragment sleep. Um, and we are a 1 sick society. We don't, first of all, we don't even eat well. And when we, even the soil that we're planting foods in is a little depleted from what it was decades and decades ago. But that's if we even put a vegetable in our mouth. We'd have to eat a lot more vegetables than our great grandparents did just to get the same amount of nutrients. So I
Yeah.
know it can feel overwhelming, right? I'm a mom. I listen to, good grief, like, what am I going to give my kids? So, sometimes you do have to supplement, because we're not getting the diet right like we should be. And you're just going to have to supplement a little bit and be open to supplementation. Ideally, we want a high fiber, it's a prebiotic. Fiber is so important when we don't have enough of that. We have a generation of children that the only vegetable they get is French fries, and there's zero fiber and they don't want to chew, and they have food aversions, and it's just crazy what has happened in the last 30 years. Vitamin D issues, we don't go outside. When we do, we put on sunscreen, so we're blocking that UVB. That's crucial. And now they're coming out saying that there's just even different levels of radiation that we should be getting.
Yeah.
And it's not just D3, there's, so D3 is helpful. But as we study this more, we need a whole spectrum from the sun, of frequencies.
Oh,
So,
100%. And that ties into what you were saying, right? So some guys feel like they don't need sleep or it's a lazy thing. When I was doing my training in psychiatry in Madison, Wisconsin, at the University Hospital, there was a grand rounds and a graduating brain surgery resident, neurosurgery resident, she was giving a talk and she's talking about sleep deprivation and the risks in the medical field. 33% increased medical errors, serious errors increased by several hundred%. And one of the brain surgeons stood up in the auditorium and said, "Your data is wrong. Brain surgeons don't need sleep," and stormed out. And this poor lady was shaking in her boots on stage. And I'm thinking, that's ridiculous. I don't want to be under that guy's knife. No
mm,
way. So it depends on the person we're speaking with, right? So if it's an athlete, I'm going to link sleep strategies and sleep problems with data that shows how it can impact their sports performance. If I'm talking to a guy who wants to lose weight or build muscle mass, I'm going to talk about sleep impacting the gatekeepers of the cells, which are hormones. So if you have less than 4 hours, if you've lost out on 4 hours of sleep, your brain thinks you need 900 more calories to consume.
mm,
Every fat cell worsens inflammation. Every fat cell converts testosterone to estrogen. If you're not getting adequate sleep, as you rightly said, you're not going to have enough growth hormone and testosterone levels will plummet. So if you have 5 hours of sleep, your testosterone levels would be equivalent to a man who's 10 years older than you. Personal experience. Got my testosterone levels down a couple of years ago, 569 average, but a little on the lower side because they keep shifting the what's considered normal every decade in testosterone because all our levels are going lower and lower. I said, let me boost it. I was being a bit of a hypocrite, traveling a lot for work. So I decided just focused on my sleep, nothing else, no additional supplements, no other lifestyle interventions. And I got my results done maybe 9 weeks later, and they went from 569 to 827.
Oh my goodness.
Yeah, and people might say, well, were you on a testosterone supplement? Were you getting injections? No, this is simple stuff. And, I was in my late 30s at the time. And what's to say for people younger than us who are exercising elite athletes? Well, your testosterone levels are extremely sensitive to sleep problems, to gut health problems. You're right about the caloric intake. We're getting unhealthier food, and our body is screaming for nutrient dense foods rather than caloric dense food. So we have to eat much more than we would originally eat because we need to get the nutrients that are essential for our functioning.
My brother, personal story, he doesn't mind. He's like, in my very first podcast was with my brother, so he doesn't mind me sharing this, but he had some low testosterone issues, and I, knew he was struggling most likely with obstructive sleep apnea, just like our dad. And so he had a test done. Yep. Wanted an oral appliance. We got him the oral appliance, resolved his apnea. He went back to the doctor to start his testosterone therapy, and they did another baseline because it had been a few months. And they said, we can't give you testosterone therapy. And he's like, why? What's wrong with me? And they said, your testosterone's great. And they're like, what? He goes, what happened? And he's like, the only thing I know is my sister made this device and I sleep better at night. And he's like, huh. The primary care goes, I wonder if that was it. I mean,
Yes, that was it.
yes, that was it. Yes, it was it. Oh my gosh, Shane,
Okay.
this is
What a good
awesome.
story.
Yeah, it is. Yeah, he always jokes like my sister helped me get my testosterone levels up, and people are like, "Well, that's weird." um, so if we could talk just a little bit, we touched on ADD, and man, I mean, when I see health histories in my practice, adults included, ADD, ADHD, and there's a phenotype really going back and forth between ADHD and like with restless leg syndrome, movement disorders. I mean, there's sleep movement disorders. There's such a connection there. Um, but what's interesting, like you said, when you go to the doctor and they say, oh, you might have ADD, based on some questions they've asked you, and then they put you on a stimulant. What I found interesting was at the Amen clinics, when you guys do your functional brain SPECT scanning, that you found many different types of patterns associated with ADD, that if certain individuals walked in and had been put on ADD medication, it would actually make it worse.
Yeah.
Um, can you go into that a little bit more? Like, uh,
Mhm.
just that there's just different patterns of ADD. Not all ADD is created the same.
Yeah, that's such a good point. It's such an important topic as well. So, as we discussed earlier, psychiatric disorders are diagnosed by symptom clusters. So, in ADHD or ADD, there are symptoms like difficulty concentrating, or maybe you can concentrate good for a few minutes, but then sustained attention is a problem. Or maybe your brain is just slowed down, so slowed processing speeds. Or maybe your executive functioning, applying concepts, is the major issue. Or maybe you have difficulty prioritizing 10 different tasks. Or maybe you have difficulty with time management and organization. So, what are the predominant symptoms that are causing you to function at a lower level or suboptimal level? But then on the brain scans, we can see correlations with different brain regions that are most affected. So, one type of ADHD on the SPECT imaging model that we use is classical or inattentive. That typically involves the frontal lobes or the cerebellum, the back of the brain, dropping, especially on concentration. So, if you're having that issue, a stimulant medication might be a good idea to drive the frontal lobes. But if you have anxiety as a predominant factor, then it's an anxious type of ADHD because that's worsening the problem. So if I give you a stimulant and you have anxiety, it's going to worsen your anxiety. So that's a bad idea. Maybe a non-stimulant medication might be an option. And I'm talking about medications after we do our due diligence. In iron levels, possible lead, sleep issues, sleep apnea, sugar, fast carbs. um, food dyes, all those kinds of things, exercise. Then we look at, well, what else are we missing? What else could we help bring into the treatment paradigm here? So
Well,
a non-stimulant medication might be good for those who have anxiety. There's temporal kinds of ADHD, which are characterized by mood instability. So if
mm,
we calm that emotional pendulum down, you might be able to focus better. SSRIs may worsen concentration because they might just numb you out or kill your motivation. Then you might need a bit of an SNRI that boosts your adrenaline for the frontal lobes too. So there's nuance to this, right? As you can
sure.
see.
Yes, there is, and really when I'm listening to it, it takes me to another sleep physician I listen to. He's out of Chicago, Lurie Children's Hospital, Stephen Sheldon. And he's really just doesn't even like the word ADD, ADHD, the emphasis being on the disorder, the D part at the end. He's like, it's really more syndromatic. We really need to be calling these syndromes because they're telling us something underlying is going on. And we really need to start looking at what could be causing these symptoms. And a lot of times it's sleep issues. you know so getting to those things earlier in life are super important. I wanted to touch on this because I know we got a hard stop soon, because this topic comes up to me all the time. And personally, with my son having had a seizure at one point in his life, I was looking into cannabinoids and the endocannabinoid system, and the science is really growing with the cannabinoid science. It's promising in areas, which is so many different conditions, and epilepsy being one of them. But you're seeing now that states are legalizing, more dispensaries are popping up. You're seeing people self-medicating for a lot of different conditions, mental health conditions, but sleep in particular. Um, and I'm assuming you might be seeing some abuse of this, possibly, or evidence of issues with marijuana use, even maybe in your functional SPECT brain scans. Can you speak to that a little bit? What are your thoughts on marijuana use and sleep and mental health? I mean,
Um,
in 2 minutes. No,
no pressure. Yeah.
no pressure.
Well, bottom line is THC use in those who have not fully developed their frontal lobes. So frontal lobes finish developing in your late 20s. Okay. So if your frontal lobes are not fully developed, the consensus is clear. You're going to increase your risk for schizophrenia
Hmm,
and you're going to lower your IQ.
hmm,
We see this on SPECT images and people who are using THC regularly. It results in what we call a global reduction in blood flow and activity. The brain slows down, regardless of the type of THC you use. Now, while THC is psychoactive, CBD is not supposed to be psychoactive. It can be obtained from the hemp plant as well. Now, there are some benefits because the endocannabinoid system in our bodies means that our bodies produce small amounts of cannabinoids on our own. And there is something to be said for the fact the endocannabinoid system regulates mood, appetite, sleep, and inflammation. So, what is a healthier way of going about supplementing our body's need? Rather than go the CBD route, I would go the CBDA route, which is an active form of CBD, and I go with the full spectrum version. Now, a good product I know is Nessa's hemp, and I've spoken to the owner many times as well. It's clean. What's unique about CBDA is that it's more bioidentical to your body's endocannabinoids as opposed to CBD, which is more synthetic. Now, it might help you with your sleep, and there's some studies that show it's beneficial for sleep. CBN is supposed to
hmm
be more beneficial for sleep than than THC without the psychoactive properties. Some say it helps promote deep sleep. Some say it reduces REM sleep. So deep sleep is necessary to flush out toxins that build up, and REM sleep is needed for memory consolidation and new learning. So if THC reduces REM sleep, it might affect your ability to learn new information. It might kill your motivation and your concentration. So you also need higher doses of CBD or CBDA. My preference would be if you are considering using something like that, use CBDA, use a good product, and
What
use
was
it
that product
like
again you mentioned? You talked to the owner, so it's pretty clean.
Nessa's hemp, Nesas hemp,
Okay.
HEMP.
Okay. Interesting. I'll put that in there.
Absolutely. So if you're doing CBDA, it's more bioidentical, more bioavailable, binds closer to the serotonin receptors. They can work on the endocannabinoid system that's associated with inflammation, appetite, sleep regulation, and not a problem with that.
Well, I appreciate that because I get that question all the time since I'm in dental sleep medicine, and I'm a big fan of CBD, like you said, full spectrum, the CBDA. I've been hearing more about CBDN, but the CBDA is new to me. I need to research that more, and this is great. A lot of people, I think, are using this as a reason or an excuse to use a whole bunch of THC. And just, I mean, there are things that THC can help with. I've heard, just especially with spasticity, if you have certain conditions with muscle spasticity. But I think most people are kind of using this for sleep or mental health issues. And man, they're just blowing up the THC. And the THC is not what is so medicinal in all of this. It's the CBD product. Like you said, we have endocannabinoid receptors because our body makes different kinds of endocannabinoids, and the receptors are plentiful. So research is definitely needed as to why we have these receptors and why we aren't producing maybe enough of our own endocannabinoids, like probably the same reason we're having issues with other nutritional aspects.
Yeah.
And I'm sure the science is going to come out on that. I know you have to go, but I have to ask you my three ending questions here that are quirky questions. And then I also want to throw out there and I'll put links for how people can get a hold of you, can get to you, can even have you speak, because I think so many people are going to hear this and want more. So, question number one, what is your favorite color?
It depends. Is it a car? Is it to wear? Is it
Oh, good. Okay, if it's to wear, what is Shane going in his closet to get to wear? If it's like, oh, I'm getting my favorite color in my closet.
if I'm feeling like my belly might be protruding, I'm gonna go for black.
Yeah.
Otherwise, I'm gonna wear white.
What if you're gonna go get a car? Like, ooh, your favorite car color?
Oh, I just got a new car a couple of months ago. Black.
Black. Oh, you kind of, I see you in black a lot. So this makes sense. It makes sense.
Yeah.
Okay. What is your favorite thing to do on your day off?
Honestly, if I lived by the ocean and just sit by the beach and just listen to the waves and watch every wave.
Mm.
Um, with free time, I like to read, catch up on things I haven't read, like quantum physics and it's how it maps onto Christianity.
Oh, I love that stuff. I love that stuff.
Really?
Yes, I
Wow.
love quantum physics stuff and just how it integrates with, like, again, we're people of faith. So, I mean, I'm very interested in that as
I've
well.
been diving into that stuff and how concepts in the Bible match onto quantum physics and how they match onto neuroscience and the work that I do in my practice too. There's fascinating overlaps, the multidimensional approach to this.
Absolutely. And it answers a lot of questions. Like people are like, well, how could that happen? Well, if you believe in quantum physics,
Yeah,
almost anything can happen.
exactly right.
I love it. Okay, last question. Holidays are coming up. What is your favorite holiday meal that you're looking forward to? Whether it's Thanksgiving, Christmas, like what's your favorite holiday meal?
Well, I wouldn't call it a meal, but we're Portuguese Indian, and so our tradition is I go to Christmas in Bombay every year to spend with my parents and my sisters. And the tradition is that my mom makes a whole bunch of Christmas sweets, Portuguese sweets, like milk cream and marzipan and
Mm.
alcohols and Christmas cake. And these are different sweets, and it's a tradition that we share the sweets with other family members and friends. And so it takes several hours to prepare each sweet dish. Stirring and stirring that. And so my great grandmas would do it, and my grandmas would do it, and my
Aw.
mom does it. And I just look forward to the sweets because they're seasonal and it just puts you in a Christmas mood. And I love that. So I'd say I'd say the sweets.
I love that. That sounds good. Now I'm gonna have to Google those and see what those dishes look like. I
Yeah, I'll
it's
send you
so
some.
please do, like, send me some pictures when you're there, like, "Hey, check it out." I love tradition. I think it's, especially family traditions, it's so comforting, and it brings us back to center, and it sounds like that's what you're gonna do this holiday season. Is that what you're are you going back this
Yes,
Christmas?
yes. In fact, when I was in Denmark, I got a book on the hygge. I hope I'm pronouncing that correctly. Denmark is considered the happiest country year after year, and they're in the frigid north in the Arctic Circle, and they don't get much sun. So why are they happy? And it's suspected it's because of this concept of hygge, where generations come together by the fire, candlelight, and just share stories from their family, from their ancestry, from their history, their culture. And so, as the ancient Chinese saying goes, grow like a tree, but never forget your roots. And we're so disconnected from that. We wonder why marriages are breaking up. Well, 55% divorce rate in this country, but there's a 99% success rate in marriages where couples pray together every day. We don't
Hmm.
talk about that. So we're so disconnected from core values, from our roots that you won't know where to go if you don't know where you've come from.
Yeah, and I believe fully too that there's a spirituality, metaphysical side to even, our sleep health and just our overall wellness. And you see that in the data. I mean, people can say what they want, but they're happier, they're living longer, they have successful relationships. There's something to be said for it. I'm going to throw out some ways for people to reach you, and I will put them in the podcast links as well. Anybody interested in learning more about ASAP Pathway and what the heck we're doing, I'll have a newsletter link in there. If you want to get Dr. Creado, Dr. Shane Creado's book, Peak Sleep Performance, you can get that on Amazon, or you can go to his website, Shane, Shane, Creado, Creado.com. Also, if you're interested in following him on Instagram, Peak Sleep Performance, is that the link on Instagram as well? I'll put it in there. If you would like to have Dr. Criado speak to your group, to your facilities, you can direct message him in Instagram, or you can email him directly at info@shanecreado.com. Friend, you are amazing. I'm so
It's
blessed to have you in my life. You're
likewise, and you're amazing. You're doing the important work that people are not aware of. So, as sleep dentists, I have the highest respect for the work that you do. You educate families. You work at this important interface in helping kids have better lives. Because while their brains are developing, you are right there in the front line. So, God bless you for all the amazing work you and your organization do.
Thank you, Shane. And happy early Merry Christmas to you and your family making all those delicious treats. And I'll see you in 2025.
Absolutely. God bless. Thank
God
you.
bless. Thanks.